education, which then increases your chances of getting a job, and then getting a job actually is linked to better health outcomes. And that is, those three elements are really closely linked. And all of that is encompassed by the environment that you have, both where you at home and at work as well. And I think lots of people in healthcare think, oh, well, you know, employment and education is not our thing. We've got enough on our plate at the moment. And schools also would think, oh, do you know what? Healthcare and employment, that's not our thing. We've got enough on our plates at the moment. Everyone's under pressure at the moment. However, the NHS it's got a huge, massive workforce crisis.
Yep.
And I kind of think it's our responsibility as an NHS organisation to look at what we're doing to help, you know, people who are interested in working in the NHS. Say, for example, have English as a second language, or kids who, for example, are having free school meals. You know, they don't get that opportunity to do any kind of work experience. And actually, I think we as the NHS are losing out. If you look across at any geographical area, the NHS is probably one of the major employers in that area. If you bring together hospitals and GP practices and community and you know, it's a huge employer.
Yes.
We owe it to ourselves and our communities to actually, you know, make employment opportunities available to people in the local area.
Awesome.
So a lot of things are not patient-facing. Admin roles, management, HR roles. Big hospitals have tens of thousands of people that work there, bigger than most, you know, companies. And, you know, if you're interested in HR, come and work in the NHS in the hospital. But I think we need to kind of go out there and, you know, just let people know that there are opportunities to work in the NHS. I think our job is to inspire people and to give people the chance to think, oh, do you know what? That's a cool job. I can do that. And just kind of get their hands on and to meet other people and to meet like doctors and managers and play with, you know, equipment and see what it's like on the other side. Even if they don't end up working in the NHS, it's absolutely fine. We just want people to think about, studying for their exams and thinking about career opportunities that they may or may not be interested in. So there's a direct link between poor education, poor employment, and poor health outcomes. There's huge issues around housing, the air that you breathe, where you live. All of these result in potentially poorer outcomes for you, being able to access care sometimes, but also to be able to get the support that you need. A lot of our staff have come from relatively humble backgrounds, and actually we want to do something for kids, and we can relate to the challenges that they have. People who come on our work experience from who have to work really hard, and hopefully they get, the harder they work, the more they get out of it.
Yeah.
But we want to be able to make that available to as many people as possible.